Hello everybody. So I wanted to talk to you about these treatments that you've been hearing about. Usually they have the same pattern, get rid of unwanted loose skin or turn back the clock on your face, gain that six-pack abdomen that you always wanted. And they always say, minimum downtime, no surgery, some kind of the pattern would be about the same. These procedures, obviously, there is some improvement, but to give you an example, I can, if somebody told you as a trainer, you're gonna gain 5 pounds of muscle, but you're not gonna sweat, there are not gonna be any weights, you're not gonna be sore after your workout, and you can eat whatever you want. I mean, if it's too good to be true, it's too good to be true. So minimally invasive procedures are not going to give you a surgical result. And at least we don't have that technology right now with these techniques. So to give you an example, if these things worked, I want to give you an example. So there are certain procedures that really revolutionized surgery. One of them was laparoscopic technique. And I remember when I was doing my general surgery, this was 1995, I think it was in 91 that we started doing laparoscopic gallbladders. And everybody was learning, so the attending was learning. And then we were watching them, and it would take 3 hours, and we were every time there was a laparoscopic, it was like, just open it up. Well, now it's just the opposite, right? We'd rarely open up the patients. There's no scar on the top here. The healing is much better. There's so many advantages to that. But if I was a general surgeon that was trained before that time, I can't say, well, I don't want to learn this technique. I don't want to do it. I would be out of business. There's no way I could have a practice and not be able to do laparoscopic techniques. So trust me, if these things worked as well as surgery, I and every plastic surgeon in the world were forced to, whether we liked it or not, to get these machines or do whatever these things are promising. Otherwise, we would be out of business. So there are people who are afraid of surgery and they want to believe that these things are going to give them the same result, and they may be happy. It's a belief thing. But if you really want to get a dramatic result, and you're an appropriate candidate, obviously, you have to do something more dramatic, which in most cases is surgery. And that means there's downtime, there's swelling. Usually it takes 3 to 6 months to go away. So always be wary. I see a lot of patients that have a cool sculpting and they come back and we lipo them. For example, these M-Sculpt, which is supposedly these electrical stimulation of the muscle to give you a six-pack, and they always have a picture of a model with 2% body fat. I don't know what to say. That idea that you stimulate the muscle is like doing 10,000 sit-ups. And this was around maybe in the 80s for a while. You can look it up, and it went away because it didn't work. So be wary. Just remember, if these really worked as well as surgery, we would be buying these machines, all right? Well, I hope this was helpful to you. If you would like any more information, and we do have some before and after photos, you can visit our website, www.drjaz.com, drjaz.com. All right, thank you and be safe.